We are associating so many people in this country with bipolar disorder. Well, do they really have bipolar disorder? You are welcome to another episode on Ask the Medic. I am Iya the Medic, and today we are going to be discussing bipolar disorder. In fact, the correct term is bipolar affective disorder. That is the full term, right? Now, the name gives it away. It says bipolar, which means two poles, right? And so it means that there's a time where the person is in an elevated mood, and there's a time where they are in a low mood or a depressed mood. Now, in bipolar affective disorder, we need to understand that, like the name says, they have two main episodes, right? The first one is what we call a manic episode, and then the second one is a depressive episode. Now, what happens in a manic episode? In a classic manic episode, the person is just hyper. They're all over the place. They are very happy. You can't really explain why they are excited, but they are extremely happy. I'm not talking about the happiness you have when you win a lottery or your wife has a baby or your boyfriend proposes to you. No, that is not what I'm talking about. Unusual happiness which cannot be explained, right? And then some of these people have other symptoms. Some of them are what we call grandiosity. You notice that people in a manic episode, they brag a lot, okay? So even if they don't have a car, they are going to be claiming that they have a car. Some of them, even if they don't know the president, they've never met him, they'll say that the president is their uncle or the president is their father. Some of them will say that Queen Elizabeth used to call them to come and, do something for her. Meanwhile, they don't even have a passport to travel, right? They just have grandiosity. They will say things that are not real and are just out of proportion. And then some of them would engage in very risky and reckless behaviors. So you'd see somebody who would maybe get on a motorbike, ride around recklessly, no helmet on. Some of them, their motors do not even have lights, and they are not worried about what they are doing at all. And some of them will engage in what we call hypersexual behavior. So they have very high libido when they are in a manic episode. So they want to sleep with anything and everything, yes. So such people, you'd see that they would have sex with anybody who is available to have sex with them. That is one of the classic symptoms of bipolar affective disorder. That is the manic episode, right? And so for such people, it is very, very important that when they are in this phase, they have loved ones and family who would come in to help them contain these symptoms. And it is important that they are getting psychological help as well. There are medications for bipolar affective disorder. That is why if you notice that your friend, your sister, your brother is having any of these symptoms that I've described, you need to get them checked. Okay, it is very, very important that if you notice that your friend is just too happy, you don't know why they're happy, they are sleeping with anybody and everybody, they are involving in reckless behaviors, they have the grandiosity that I've talked about, it is very, very important that you get them some help, right? And then they can have the depressive episodes where they are sad, they do not want to mingle with anybody, they don't want to eat, they are just, withdrawn from society and everything, okay? And so it is very, very important that in the depressive episodes as well, they need all the love and the support that they can get. Now, we need to understand that mental health conditions are very, very traumatizing for the victims or the patients. And so we need to stop stigmatizing them. I know that sometimes their behaviors can be overwhelming for even us as loved ones and family, but they need all the love that they can get at that particular point in time. So with all these things that I've said, all the people we are usually associated with bipolar affective in this country, do you still think they have bipolar affective disorder? Let me know in the comments section. And if you have any other questions, make sure to send them to us in the comments section. In subsequent episodes, we'll be responding to some of the questions that you send us in the comments section. I am Iya the Medic, and until I see you again on the next episode of Ask the Medic, it's bye.